nurse since 2000, so 13 years this December. My job is I'm a nurse, I'm a public health nurse, and I'm a mother, I'm a wife, I volunteer, I'm a member of the DEA. That's what's my job. When I first applied for the nursing program, I was accepted by the student financial assistance, and because I'm Aboriginal, I was able to get funded for the access year. And because of my grades, I put in for different scholarships through the Inuvialuit Education Foundation, and I got pretty much a scholarship for every semester because of my grades. It was difficult, it was very challenging. I was 20 years old with a baby, and I had family support, so that was good. It was in Yellowknife, which I knew Yellowknife, and I had housing that was right in the college. So my apartment was in the same building as the college. And my husband was there for me. Public health nurse is a nurse who is a community nurse. Like what I do is health promotion a lot in my job, so it's a lot different than a hospital nurse. And I work a lot with the community, in the community, so I'm out of the office a lot. My role is actually the school nurse, so that's one of my main roles, but I also do a lot of other things like immunization and health promotion and teaching in different areas. So how I balance things in my life, it's, I mean, from the beginning to now, when I started my nursing career, I was working, my husband was working, we only had one child, and, trying to do shift work with him being a truck driver, working 12 hours a day was very difficult, so I had a lot of other friends and family who would kind of help out. And then after about 2 years, when I was at the hospital, I moved over to public health just because it was just more of a 9-to-5 job, and it was easier with my son and family, and it was easier to balance my day. When I finally went into nursing, the reason why it kind of played in my head, like I need to have a job to support my child, something that I'm going to be able to always have a job doing. Just working with people, and people, like, when you walk into the room and somebody's sick and they know you and they just feel so, they tell you that they feel so comfortable that, oh, I'm glad it's you, because I had a really rough day, and now you're here to take care of me, so, and that just feels real good. Just get schooling done, it's over and done with. And there's so much opportunity, there's so much money out there that you can get, that you can go to school, especially when you're Aboriginal and you live in the north. There's so much funding out there that you can find, that when you graduate from a degree program, you have no debt, and there's so many other people out there that don't have that opportunity. And now that I see it as I'm older, and people are not grabbing on to that, and just giving back to your community, like when you're young, oh, I'm just gonna do this, I'm gonna leave, I'm gonna go somewhere else, I wanna be out of here. And then, as you get to a certain state, it's like, okay, well, my family's here, my friends are here, and then you feel good about your job because, people seeing you do good things for your community.